Again, thank you for downloading this video series. Disc correction therapy is a group of therapies that have been all placed together in our office to get optimal results with your disc problem. The foundation of it is decompression. And what we do is we decompress the spine. We actually pull the spine apart, creating negative pressure within the disc, and it pulls the disc back into where it should be. It also pulls new oxygen and fluid and nutrients into the disc. And we actually have many before and after x-rays where the disc became thicker after the treatment. Now that indicates that we actually reversed the aging process of that disc and made it healthier, thicker, stronger. What I'd like to do now is give you more details about the therapies that we perform. A vital part of disc correction therapy that is performed in our office is rehabilitation. If you don't have muscles that are engaged and as a result have a disc problem, that disc is corrected but the muscles are left the same, then the problem is just going to come right back. So we exercise the patient through progressive rehabilitation program that is designed to strengthen core muscles and keep the spine as stable as possible. The foundation of the disc correction therapy treatment that we do in our office is the decompression table. This is successful for a number of different reasons. There's a bent knee position. This takes the curve out of the lumbar spine and allows us to better decompress each individual disc. We can raise and lower the height of the table, and this allows us to decompress the exact right disc for each individual person. The belts, there's a torso belt and a lumbar belt, and the decompression occurs between the two of them. There's also a split table, and the table actually moves as the treatment occurs, and this allows for less friction between the patient and the table. And then we can set the decompression computer to the proper amount of decompression and time for each individual patient. With all these factors together, along with the exercises, are what really make the decompression therapy or disc correction therapy that we have in our office the most successful. A vital part of disc correction therapy that we perform in the office is the chiropractic adjustment. And to understand why, you have to understand how discs have problems to begin with. If the joints are moving, then fluid gets pumped in and out of the disc and everything is healthy and fine, no problems. But when the joint locks, then that fluid pumping action stops or is decreased, and the disc will start to crack and dry out and become thinner and weaker. And then eventually the disc will bulge or herniate, as we talked about previously. And what we do with chiropractic is we push into the area where the joint is locked and add the normal free motion that should be there. And when that is restored, this pumping action can be restored. The disc can be brought back to a more normal height and a more normal strength so the problem doesn't return again.